Hello, you're listening to coronavirus updates on The Wire. Since the last 2 days, India has been recording over 80,000 new coronavirus infections. Here's a quick look at COVID-19 tracker for state-wise numbers. Jammu and Kashmir recorded more than 1,000 COVID-19 cases in a day for the first time on September 4. The infection tally in the Union Territory is now over 39,000. In Haryana, 2 dhabas in Murthal were sealed on September 4 after their 75 workers tested positive for COVID-19. A majority of 65 workers were tested positive at the famous Amrik-Sukhdev Dhaba. In Rajasthan, a BJP state president, Satish Poonia, has tested positive for COVID-19. Kerala's Chief Minister Pinarayi Vijayan said on September 4 that the situation in the state was not good, as 1,500 new coronavirus cases and 10 fatalities were reported, taking the total infection count in the state to over 79,000. In Delhi, Mohalla Clinics will soon be turned into COVID-19 testing centers between 2 p.m. and 6 p.m. every day. In addition to this, the Delhi International Airport will also set up a COVID-19 testing facility for passengers. On the 3rd of September, the centre pulled up states with a high positivity rate of COVID-19 among health workers and asked them to evaluate the situation. So far, Telangana has reported 18% coronavirus positivity rate among health workers, which is the highest in the country. Maharashtra has the second highest rate at 16%. There is no government data, however, to show how many health workers have been infected so far, but the actual figure is expected to be much higher. Maharashtra, Andhra Pradesh, Tamil Nadu, Karnataka and Uttar Pradesh together account for 60% of India's caseload positivity rate among health workers. An article published in Monga Bay, which has been republished on The Wire Science, points to the problem of increasing COVID-19 waste in Mumbai. Tanvi Deshpande has written the article and it notes that COVID-19 related biomedical waste is piling up along with regular biomedical waste generated in the city. For the city's biomedical waste needs, a common biomedical waste treatment facility is located at Deonar in central Mumbai. The plant's incinerator has a capacity of 24,000 kilograms per day that was underutilized in the past. Before the outbreak of the pandemic, Mumbai generated 10,000 kilograms to 17,000 kilograms of biomedical waste every day, which was sent here. According to data from BMC's Solid Waste Management Department, by July, Mumbai generated a total of 12,000 kilograms of COVID-19 waste on an average every day. This is almost at par with regular biomedical waste generated in Mumbai before COVID-19. Now the capacity of the biomedical waste plant is about to run out. Deshpande notes that an indication of this came recently after hospitals raised a stink over the pile of COVID-19 waste bags lying on their premise, since the company which operates the incinerator had failed to dispose them for days. Eventually, BMC had to help the contractor to dispose it off. The problem of the lack of disposing sites for COVID-19 waste has compounded the existing problems of biomedical plants generating tons of smoke that has reduced people's immunity who live in the vicinity of those plants. And this health hazard is coming in the way of setting up new biomedical waste plants for COVID-19 waste. To read more about this story, log on to The Wire Science. A World Health Organization spokeswoman has said that WHO does not expect widespread vaccinations against COVID-19 until the middle of next year. She also stressed on the importance of rigorous checks on their effectiveness and safety. She said, and I quote, "We are not expecting to see widespread vaccination until the middle of next year." According to her, none of the vaccine candidates in advanced clinical trials so far have demonstrated a clear signal of efficacy at the level of at least 50% sought by the WHO. Russia granted regulatory approval to a COVID-19 vaccine in August after less than 2 months of human testing, prompting some experts to question its safety and efficacy. Pfizer and German company BioNTech's vaccine is in the phase 3 trials, and so is Oxford AstraZeneca's. However, responding to widespread criticism of their vaccine, a Russian official cited the results of the vaccine's early trials published by The Lancet on the 4th of September. The Russian official said, and I quote, "With this publication, we answer all of the questions of the West that were diligently asked over past 3 weeks, frankly with the clear goal of tarnishing the Russian vaccine. According to the published results in The Lancet, early-stage trials of Russia's Sputnik V vaccine showed that vaccine produced an antibody response in all participants. The results of the two trials conducted in June and July this year involving 76 participants showed 100% participants developing antibodies to the new coronavirus and no serious side effects. Indonesia has become the country with the highest virus death toll in Southeast Asia. But as the country struggles to contain a surge in coronavirus cases, authorities are trying shock tactics to catch the public's attention and drive home crucial health messages. Local government officials don full personal protective equipment, hoist a wooden coffin on their shoulders, and set out on a funeral procession down the busy city streets. A Reuters report has noted that nearby other officials hold up placards and use loud hailers to urge residents to follow health protocols, including wearing masks and social distancing. Some residents watching the coffin parade told Reuters, "Now people can understand the consequences. Without this initiative, people will always break the rules." Thank you so much for tuning in. We will be back with another episode of COVID-19 updates on The Wire. Until then, keep reading The Wire and The Wire Signs, and don't forget to hit that notification bell button for more updates from us.